Enhanced External Counterpulsation, or EECP, is a non-invasive outpatient treatment for coronary artery disease, specifically angina and heart failure. It utilizes timed inflation of pressure cuffs on the calves, thighs, and buttocks to increase blood flow to the heart. During diastole, the cuffs inflate to push blood back towards the heart, increasing coronary perfusion pressure. Then during systole, the cuffs deflate, reducing resistance in the aorta and increasing cardiac output. A typical EECP regimen involves 35 one-hour sessions over 7 weeks. The concept of counterpulsation originated in the 1950s when it was observed that the phasic rise and fall of intra-aortic balloon pumps improved coronary perfusion. This led to the development of the first external counterpulsation devices in the 1960s. In the 1980s and 90s, Vasomedical introduced enhanced external counterpulsation, which optimized the inflation-deflation timing sequence to produce maximal hemodynamic effects. EECP utilizes a sequential inflation and simultaneous deflation algorithm. This maximizes diastolic augmentation and systolic unloading. In 1994, EECP therapy was approved by the FDA for stable or unstable angina pectoris. In 2002, additional data led to FDA approval for use in congestive heart failure. EECP remains an FDA-cleared treatment for refractory angina and heart failure. EECP is believed to work through several mechanisms: diastolic augmentation, promoting collateral circulation, improving endothelial function, and afterload reduction. Numerous studies have validated these physiological effects and shown improvement across all cardiac parameters. As per FDA clearances, EECP is broadly indicated for patients with angina pectoris refractory to medications and unsuitable for revascularization and heart failure, specifically NYHA class 2-3 stable heart failure. It also has evidence for beneficial use in other vascular diseases: coronary artery disease without classic angina, peripheral arterial disease of the lower extremities, erectile dysfunction, and chronic kidney disease. However, further research is needed to support FDA approval for these additional indications. There is a wealth of data from clinical trials supporting use of EECP in cardiovascular disease. The International EECP Patient Registry and the multi-center study of Enhanced External Counterpulsation are just a few that have reported significant improvements in patients after EECP. Despite a relatively large body of evidence on symptomatic improvement, EECP remains controversial for several reasons: mixed data on hard outcomes, unknown durability, mechanism not completely understood, and lack of reimbursement. EECP usage is widespread across the globe. As of 2016, there were over 300 EECP centers worldwide in over 40 countries, with over 100,000 patients treated. Areas for improvement include patient selection, combination approaches, technology enhancements, treatment protocol optimization, outcome assessments, and investigation of new indications. The positive clinical effects and safety profile of EECP have spawned research into a variety of innovative counterpulsation-derived treatments seeking even greater efficacy. In summary, EECP is a safe, effective treatment for chronic angina and heart failure, which improves symptoms, cardiac function, and quality of life for patients. The future is bright for external counterpulsation, playing an increasing role globally in combating the epidemic of cardiovascular disease.